Good afternoon, and welcome to Juniper, a resource for chronic disease management and community health. This webinar is sponsored by the Minnesota Department of Health and hosted by the Healthcare Homes Initiative in partnership with the Minnesota Area Agency on Aging and Innovations for Aging. My name is Carol Bauer. By the end of this webinar today, participants will be able to identify benefits of the Juniper program, explain how Juniper is serving patients in primary care and public health, and finally, to describe how to become a part of the Juniper network. I'll introduce our presenters in a minute, but first I'd like to take a minute to review some housekeeping items. To prevent feedback and sound problems, please put your phones on mute by pressing *6. Please don't put your phones on hold, as that sometimes causes feedback issues. We invite your questions through the chat function, and we'll address as many as we can in the last 10 minutes of the webinar. Now, I'd like to introduce our speakers. Sarah Lindquist, MD, is a Director of Healthcare for Integration for Juniper. In this role, Dr. Lindquist fosters partnerships with healthcare organizations and provides outreach to healthcare leaders and health plan medical directors on the benefits of the Juniper program. Dr. Lindquist is a board-certified internist and geriatrician. She received her training in internal medicine and geriatrics at Hennepin County Medical Center and practiced internal medicine and geriatrics at Park Nicollet Health Services for 8 years. Mark Cullen, Master of Public Administration, is Vice President of Strategy and Operations at Innovations for Aging and Director of Programs and Advocacy for MAAA. In his role at Innovations for Aging, Mark sets strategy, develops critical business-to-business relationships, and negotiates contracts, along with overseeing operations. At this point, I'm going to turn the program over to Mark. Welcome, Mark and Sarah.
Well, thanks, friends. Thanks for the opportunity to have a chance to talk with you this afternoon now about Juniper and share a little bit of the vision that we've got for Minnesota and helping Minnesotans take control of their own health to meet their own health goals. Juniper is actually a collection of area agencies on aging who have been funding evidence-based health promotion activities in Minnesota for nearly 30 years now. You probably know these programs as Tai Chi Quan Move for a Better Balance or Matter of Balance, a diabetes self-management program that have been operating across Minnesota communities for many years. Most of that work has been funded by the Older Americans Act through its Title III-D funding. And you know, the trick with Title III-D funding, as it is with much of government funding, is that it doesn't grow much year to year. We're unable to scale it to meet demand. About 3 years ago, a large national foundation gave us a grant to see if we could scale this work. And as a part of that grant, we created a new infrastructure for the AAAs to be able to come together, to work together to offer more classes all across the state. And so that is why I wear two hats. I wear one hat as a AAA Programs and Advocacy Director, where we make grants, Title III-D grants to support classes in the metro here. But then I wear another hat, as Carol was describing, in Innovations for Aging, where I'm the Vice President of Strategy and Operations, responsible then for this statewide work that we've now grown. And it really is just remarkable how it's grown, and I'll get to that in a bit. But I wanted to share that context with you so that you knew that the same folks that are at AAA that you've known for many years are the same people behind Juniper, and we're just in a different structure. So that's what Juniper is about. We do think that there's an opportunity here now to, as classes grow and as we become more sophisticated as a network, we think there's an opportunity to wrap Minnesotans with the broader social service supports that may help improve their health goals. The Older Americans Act actually has many titles inside it, which create opportunities for funding things like chore services, caregiver supports, and nutrition. In fact, nutrition funding, home-delivered meals, and congregate dining is by far the largest book of work for us in a AAA. And so there's this new opportunity now to be able to marry up an evidence-based diabetes self-management program, as an example, with healthy meals delivered to a person's home. So that's also on the horizon, and just wanted to give you a sense of that vision. But before we go too much more into the administrative structure and how we can work together with you, I thought I'd ask Dr. Lindquist to share a bit about the evidence that these programs are rooted in, and give you a sense of how that's rolling out in a healthcare and a clinical setting.
So, hi, I'm Sarah Lindquist. As Carol was saying, I am a board-certified internist and geriatrician, and I worked for Park Nicollet Clinic for a number of years before I left practice and to spend some time with my young children. And so I'm really excited to share with you what I know about these programs today. These programs speak directly to my experience as a primary care provider, and I really feel strongly that, especially in a primary care setting, offering these programs can really enhance the care of your patients. So just a little background regarding what these programs speak to specifically. So chronic disease, this is the epidemic of our lifetime. According to the CDC, 1 in 2 adults suffers from a chronic condition such as heart or lung disease, high blood pressure, diabetes, or arthritis, and 1 in 4 adults suffer 2 or more of these conditions. So modifiable risk factors such as lack of exercise, poor nutrition, alcohol abuse, and tobacco abuse account for much of the illness that leads to chronic disease and early death. This comes at a really big cost. The cost of chronic illness is over $2 trillion nationally in 2014, and in Minnesota alone, that cost was over $20 billion. Additionally, the opioid crisis is now a public health emergency with over 50,000 deaths related to opioid overdoses in 2015. Let's switch slides here. Okay, so falls. Falls are another thing that these Juniper programs specifically target. 1 in 3 adults over the age of 65 fall annually, and falls are the leading cause of fatal injury among older adults. Furthermore, half of all non-injured fallers cannot get up without assistance. And those people who do not suffer a fall, who do not suffer an injury as a result of a fall but are unable to get up without assistance, still suffer lasting declines in their activities of daily living, such as bathing, transferring, feeding themselves, maybe getting to the grocery store, that sort of thing. Fear of falling is a recognized syndrome among older adults as well, and causes adults to limit their activities, which leads to further physical decline, depression, social isolation, and feelings of helplessness. In 2015, there were over 2.8 million injuries treated in emergency rooms due to falls, and over 800,000 hospitalizations for a total cost of over $50 billion. Now I'm going to change the focus here a little bit and talk to you a little bit about health literacy and patient activation. So as you all likely know, there are varying levels of health literacy among the population that we all serve. So studies have shown that those with a below basic or only a basic level of health literacy incur more visits and greater expenditures than those with an above basic health literacy. So public health strategies aimed at promoting education among low literacy consumers may help improve outcomes and lower costs. Additionally, activated patients are those folks who have the knowledge, skills, and competence to manage their own health and health care. Activated patients have a lower prevalence of chronic conditions, less ER visits and hospitalizations, and are less likely to develop new illnesses. So what are evidence-based health promotion programs? As Mark already introduced, Juniper is the initiative that offers evidence-based health promotion programs to our Minnesota community. Now these programs were developed and studied, or have been developed and studied by various organizations both nationally and worldwide. So evidence-based programs help people manage their chronic conditions, prevent falls, foster well-being, And these programs give adults the tools they need to take control and ownership of their own health and to better manage their health care needs in an effort to improve outcomes. Most importantly, evidence-based health promotion programs are not meant to replace standard medical care offered by patients, clinicians, and providers. This is meant to be an adjunctive form of care, such as offering, just recommending physical activity or recommending a healthy diet, or it can be thought of as an order to help somebody manage their chronic illness, such as a provider would order a blood test or a new medication. Juniper offers what I like to think of as two core types of evidence-based health promotion programs. So for ease of explanation, I break these up into chronic disease self-management education programs and fall prevention programs. Starting with the evidence-based, or the chronic disease self-management education programs. These programs were developed at Stanford University and are now licensed through the Self-Management Resource Center in California. Chronic disease self-management education programs are 6-week programs. They meet 1 time per week for 2.5 hours a session. These classes are generally lay-led by trained volunteers who follow a specific methodology. These classes are highly scripted. The instructors use a manual. The class follows along in a manual. Classes generally follow the format of a guided lesson followed by a moderated discussion and then a generation of an action plan. Then the participants of the class go out into the world for the next week, try to put their action plan into action, and when they come back, they have the opportunity to discuss how that went and participate in some peer coaching. The most generalized class offering is the chronic disease self-management program, but there are also classes that are more focused on chronic pain and diabetes. Fall prevention programs. So the fall prevention programs that Juniper offers are Tai Chi Quan, Moving for Better Balance, A Matter of Balance, SAIL, or Stay Active and Independent for Life, and Stepping On. A Matter of Balance is a cognitive behavioral program that teaches coping strategies to overcome the fear of falling, thereby by reframing falling as something that is controllable. Tai Chi Quan is more of an exercise-focused class designed to improve strength, balance, mobility, and daily functioning. This class is a really great option for non-English speakers, as it is a movement-based class and not focused on classroom-style learning like Matter of Balance. Stepping On and SAIL are 2 programs that are offered less frequently, but just a brief overview. Stepping On is a program that provides information to participants on how to identify fall hazards, problem solving with regards to balance and falling, helping participants identify strategies for getting about in the community, recommending safe footwear, and how to manage medication in terms of balance and falls. There is also an exercise component to this class that incorporates weights to improve strength and balance. SAIL, Stay Active and Independent for Life, is an exercise program that combines aerobic conditioning, strength training, and balance exercises. So the benefits of these evidence-based programs, as I stated, these programs have been studied both nationally and worldwide, and studies of chronic disease self-management education programs have shown improvements in a number of outcome measures, including self-reported health, self-efficacy, fatigue, disability, depression, medication adherence. It has shown improvements in communications with physicians and reductions in healthcare utilization and hospitalizations. Specifically, the diabetes self-management program has shown improvements in A1C and hypoglycemic symptoms. With regards to fall prevention programs, multiple studies have shown reductions in fear of falling, reductions in fall rates, and the risk of multiple falls, as well as improvements in balance. And the impact of these programs. So a study done on the chronic disease self-management program showed significant reductions in emergency room visits at 6 and 12 months after completion of the program. There was also a reduction in hospitalizations at 6 months for a potential net savings of $364 per participant. And that was extrapolated out to reflect a potential national savings of $3.3 billion if only 5% of adults with one or more chronic conditions were reached with this program. A recent study that was just published on the diabetes self-management program showed a direct cost savings of $815 per participant in the program. And with regards to a matter of balance, there was a Medicare report to Congress in 2013 that showed a $938 savings per participator with respect to unplanned hospitalization, need for skilled nursing facility, or home health care. So community dwelling adults only spend a fraction of their time in a clinical setting versus time spent out of direct clinical care. And given that most care and management of chronic illness happens outside of this clinical setting, I think Juniper programs are really critical to empowering Minnesotans to think about their chronic condition as something that they can positively manage. Really good news for us is that healthcare systems are becoming more and more interested in offering these programs directly to the populations that they serve. And I just wanted to touch briefly on what really drives health outcomes. This is sort of an old study, but it showed that 40 to 90%, anywhere from 40 to 90% of poor health is attributable to social, economic, and behavioral factors, while clinical care only drives health outcomes about 10% of the time. So many physicians may recognize that unmet social needs lead to worse health outcomes for their patients, but the majority of physicians do not feel confident that they are able to adequately address these needs. This makes a compelling case to engage social service providers such as the AAAs and the Juniper program to help improve the health of older adults and contain healthcare spending. Personally, as a physician, I would refer patients to these programs because I believe they can empower patients to take more of an active role in their health, thereby improving their outcomes and their quality of life. These programs are often held in a community setting where people are more comfortable. The leaders of these programs are often lay volunteers, many of whom share similar health experiences and challenges as the people who are taking the class. So this model of delivery offers participants a more personal view of how to live with their chronic condition rather than just being told by a medical provider who may not have the first-hand experience of all that condition may affect one's life. The challenge here, pardon me, there we go. Okay, the challenge is in educating healthcare providers what these programs are and how they can help their patients. And my role as the Director of Healthcare Integration is to help educate providers about what these programs can offer and help facilitate the referral of patients to these programs. So we are reaching out to healthcare homes, healthcare coordinators, and nursing staff to think about Juniper programs as a resource for the patients you serve. As Juniper has grown and developed, the demand for these programs has quickly surpassed expectations, and Juniper is working hard to train leaders to help fill the demand for these programs. Now I'm going to turn it back over to Mark to give a little bit more information about what Juniper has accomplished so far and how you can access Juniper programs.
Okay, so Sarah, thanks for that overview of the programs, and it really helps us understand how these programs might benefit the patients and neighbors that we all have throughout the state. So, you know, we have now a network of over 150 organizations all across Minnesota offering these classes. And about 45 of those organizations are what we would call a healthcare sector organization. So they might be a skilled living facility, they might be a rehab center, and of course large health systems. In fact, most of the large health systems in Minnesota, you think Essentia, Sanford, Fairview, and Health Partners, they're all offering at least some of the programs in Juniper's menu of programs. And so that's fun to see the uptake of those organizations. There's also a fair amount of partnership with county public health and SHIP grantees, and so we're exploring how we might grow that as well, and very interested in your thoughts or your input into how that might also work. You can see here completers by program. This just gives you a sense of the popularity of the programs in a matter of balance, I think because of its name recognition and the long history here in Minnesota of offering those programs. That's got the broadest base. Similar is the Tai Chi Kwan and Living Well with Chronic Conditions. Those three programs have long been offered in Minnesota, and so we've got a fair amount of momentum. If I was to show you a different chart, you would see chronic pain taking off just in the last, I'd say probably 9 months or so. That one kind of looks like a hockey stick. So there was very little capacity in Minnesota for that program 2 years ago, and that's growing very, very quickly. We're optimistic about that. Sarah was talking a little bit about the impact of the programs, and we have some internal data about participant experience with these programs. And what I think you see here is just a broad and deep commitment of the participants to taking steps to embrace their ability to manage their health. The one here that I like so much is the one on the far right, the 52% of folks who made changes in their home to reduce their risk of falling after taking a falls prevention class. So you can really see here from these statistics that people are really engaging and really taking control of their health. We see something similar here in the chronic disease self-management program, and I come from a background in trying to prevent isolation in older adults through volunteer programs. And this one on the far right here again, helping older adults cope with emotions like depression because they're involved in these programs, is one that really tugs at my heartstrings. It's so important it is so important to help folks build a community in their retirement or as they become more and more isolated in their communities as their life changes as they grow older. And so we think that this program helps create new friendships, creates new social communities, and is a real opportunity for folks to engage with others in a meaningful way. So I think, the last couple of slides here are really about an appeal to you to help us think about how we can touch the lives of more Minnesotans. When we started this effort to scale these programs across the state, we thought a really ambitious goal would be to touch 2,000 lives across the 3-year grant from the large national foundation, and we were wrong about that. In 2018 alone, by the time we're all done with just this year, we think we'll touch about 5,000 Minnesotans. And by the time the full 3-year grant is done, we're estimating somewhere between 7,300 and 7,500 total Minnesotans will have taken a Juniper class. And so we've tapped into a demand here that, frankly, we don't totally understand, but we know that there are Minnesotans who really want to take these classes and are seeing the benefits. And so we're looking for partnerships now across the state where we can help more Minnesotans access these classes. There are a few kind of interesting ideas that have come to us. One is to use these classes to optimize patients for surgical intervention. So, as an example, some surgeons won't operate on uncontrolled diabetics. Others are worried about someone's risk of falling following surgery. And so there may be an opportunity to pair these programs with an intentional surgical intervention or other type of care plan to really accelerate patient health outcomes. Another is just, working with providers and actually, interestingly, payers to identify patients who are most likely to benefit from these classes. We want you to note the cost of the class is generally free. In some cases, our partner organizations will charge a small amount to cover the cost of offering the class, things like snacks, books, and other things. But many, many, many of the partners offer the programs for free in Minnesota communities. And we're excited to announce that beginning on January 1st, we believe we'll have contracts with Blue Cross Blue Shield and health partners in their MSHO products to offer Juniper classes to their members for free. We're just coming to the final stages of those negotiations, and I'm confident enough in where we're at to be able to say that we're looking forward to that with those two plans. Last couple of pieces here. These relationships with the plans have been evolving and have been very interesting. I can share that my experience all across the board with every plan we've talked to has really been, I guess the word is remarkable. You know, they want to engage with us in to test these ideas and to test these programs to see if they have a broader benefit for their members and help them stay healthy and engaged in their communities. It's really been interesting. And so, as an example, Blue Cross Blue Shield of Minnesota is working with a group in the Wilmer area to offer Juniper classes to Medicare eligible folks. But what they've also said is that they don't want to just limit it there. They're interested in seeing the broader uptake and the broader interest in Juniper classes, and that could be just anybody who lives in that area. They're really just kind of interested in pilot testing these programs there. So if you're in the Wilmer area, if you haven't already been connected to that, I'd be happy to connect you to that group that's working on that. And then, you know, I think the last thing here is, you know, there may be an opportunity for you to become a provider organization and offer classes in your clinic. And then what happens is we can develop a contract situation where we're actually reimbursing your organization to offer the classes, and that's what happens today with many of those 150 organizations that are partners with us today. The last thing is just a quick demo of our website so that you can see how folks get signed up. And I'm just going to try to do a live demo here, so just bear with me. I'm going to do this on my desktop. I'm going to bring this down here. And so you see here, this is our live website, and we have a few ways to interact with us here. The first and most commonly used feature of the website is just to enter a zip code and find out where the class is that's nearest to you. I have to say that, you know, we've been offering evidence-based health promotion, disease prevention classes for, I mentioned, almost 30 years in Minnesota, but we've never had a way to calendar classes and make them searchable in this way. My first interaction with this work was some frustration that a tool like this wasn't available, and so it's so fun to see that this kind of a tool is now available. And it's actually being looked at by a few other states, including the state of Maine, that has adopted this same web platform to calendar their classes that are in this same book of work. You can search a couple of ways, and what I think I'll do is just pick a Brainerd zip code and just see. I actually haven't done this yet today, so we'll see what we've got available in Brainerd today. And what you can see here is we've got 4 results within 30 miles of Brainerd. There's a matter of balance class. There's another matter of balance. Looks like 3 matter of balance classes and the living well with chronic conditions class. The website allows a person to register right here online by clicking that button. You can get detail about the class here, including where it is and who the leader is and who the contact is. In this case, this is the Brainerd Family YMCA offering this class. You can also make a referral. So if you happen to be in a clinic setting, and the way that I'm imagining this happening is that a patient would go to a physician and the doctor might say, you know, it looks like you might have diabetes, or, you know, we've run some tests and they indicate you do have diabetes, and have you considered a diabetes self-management program? If you go down the hall here, our care coordinator can help you get set up. And that care coordinator can actually go to this page here and help the person register right through the website, or they can also make a referral, and they click that button there and they give us the information from the patient and who is actually referring. They confirm that they're not a robot and submit the information, and then we'll actually call and get the person registered. And so that takes that work out of the care coordinator's hands or out of the physician's hands, and hopefully creates a more efficient process. So that's the website, that's the tool. Of course, the website has a really robust data capture capability so that we can understand how many folks are attending classes and where they're attending, and get some sense of the popularity of classes, and then gather some of that outcome information from patients about how they've experienced the class and anything we could do to improve them. So we're always looking for those opportunities to enhance this work as well. I want to leave the last little bit of our time here together just to answer some questions if there are any, and I think if I understand right, I can go into the chat and have a look for questions. So I'm going to try to do that here. And I'm not seeing any questions. Does anybody have any questions? You could use the chat.
This is Carol. I'll start you off with a couple of questions, and maybe if other people have them, they could enter them into the chat while we're talking. So, there's nothing like a story to explain, the value of these programs. So I'm wondering if you have a couple of, success stories that you might want to share about a patient who turned things around by attending a class.
Yeah, there are some on our website that we've shared, of course, but the one that I can tell you is the power of a guy who had some brain damage and was using the falls courses as an opportunity to help him with his balance and really take back control of his life and his ability to get around town. He was a younger guy, actually, so he wasn't the typical person that we serve with Older Americans Act funding, which tends to be people 60 and over. He was under that age, and I think is a nice example of how these programs might benefit folks who don't fit the typical profile. How's that?
Okay. And I had another question. I noticed that most of your classes are lay-led. So how do you find lay leaders, and are they trained, or how does that work?
Yeah, they are. So, part of the way this works, and I think when it works the best, it works this way. An organization that we're partnering with will develop a relationship with that organization. What they typically do is they have a paid staff member on their team that is trained, and then they identify volunteers, local community volunteers, probably somebody who's already connected with their mission and their work, who says, I'd like to take one of these classes, or I'd like to teach one of these classes. Oftentimes it is somebody who has taken a class and said, gee, I want to share the broad benefits that I've experienced with others. And so they're able to sort of share the inspiration that they found. Together, after that training, they offer those classes and that work to members of their community. And what I think is what's really interesting and really nice about Juniper is, because we have such a broad mix of partners, we have organizations, Korean Service Center, Lao Advancement, and many, many others who are organizations who are operated by and for people of color, even people who don't speak English as their first language. And so then they're offering these classes in their native languages. So all of that really has that local look, feel, and touch.
Okay, great. Dorothy, do we have any other questions coming through?
Yes, we have one question. It says, thank you for this webinar. Currently, there's no course offerings for Arthritis Foundation exercise programs. Are there plans to offer these in the future?
Yes. So I think one of the things that we've got an opportunity to do across the state is to have a more even distribution of the types of classes that we're offering. So you've picked up on the Arthritis Foundation exercise program, but there are certainly others, and chronic pain is one of them. I mentioned that earlier, that we've not had a lot of capacity to offer that in the state up until recently, and that's growing all the time. So what you'll see is classes coming on and off, and it changes every day. I get an email every time that a class is calendared, so I probably get, 5 or 6 of those emails a day where a new class is coming on board. And so it's just a matter of time. But if you want a class in your area, that would be very useful for us to know. And so if you'd reach out to us and just send us an email at info@yourjuniper.org, or even give us a call, we'd be happy to see what we can do about generating a class based on the local interest that you found.
Okay, any other questions, Dorothy?
No.
All right, well, I have one last one, and this is one that I think you're interested in learning a little bit more about too, and that is, what is the secret sauce or the key to getting patients engaged in programs like this? I mean, does it take that referral or that little nudge from a care provider, or some patient, what gets them into this to the point that they're successful?
I think that's something that we are still working on, but what we do know, according to the Center for Disease Control, if a patient's physician recommends these programs, they are 18 times more likely to participate than if they do not have a provider recommendation. And so we think it's really key to get providers to recommend these programs to their patients. That doesn't mean that the provider then has to go and put all the information into the website themselves. You know, if there's a care coordinator in the clinic who can do that for them, that saves them that bit of work, or just simply giving the patient some information about the program. And for example, up in Duluth, Essentia Health has developed a prescription pad where the provider, in their clinic rooms, they're going mostly paperless, but they have agreed to have a paper prescription pad in the room where the provider can sort of write a prescription, if you will, for one of these programs and hand it to the patient, which then they can bring to their front desk and be registered, or they could take it home and do it themselves if they have access to a computer. And so we think it's really key that providers recommend these programs to help get patients involved. And then the rest of that is still a question that we're looking into with regards to what activates a patient to want to take more of an active role in their own health, and how can we better light that fire for them, or help them get to that point.
Okay, great. Any other questions come through, Dorothy? Okay, do you want to advance to the next slide? All right, so I'd like to close things up here, I'd like to thank Sarah and Mark for being with us today. As they explained, you know, we can all work together to improve the health of our older population by focusing on just these two things: chronic disease management and falls prevention. And if you're interested in learning more or becoming a part of the Juniper initiative, I hope you'll visit the Juniper website or reach out to Sarah and Mark for more information. If you'd like to continue this conversation online, we'd invite you to join the conversation on the Learning Management System Discussion Board. So this is sort of a new feature, and it may take you a while to get used to it, but you've already logged into the LMS once in order to register for this webinar. So you log in, you click on Browse Training, and then you click on the Communities icon down in the lower left menu to join the Juniper discussion. And while you're logged into the LMS, I hope you'll take time to look at the upcoming training opportunities for healthcare homes, and that includes a couple things that I just want to mention real quickly since we have time. One is the Behavioral Health Integration Summit, and this is a live training event that happens in St. Paul next week, September 25th. And Joan King is going to be with us. She's a nationally known speaker on the topic of primary health, behavioral health integration. Going to be a great event. It's free. We've got another event coming up in Duluth on October 16th, again, a live training event, Finding Our Way to Integration. This is how you set the stage for developing integrated care. And this will be facilitated by ICSI, and again, it's a free event. And then finally, we have another webinar coming up on October 10th, in a little less than a month, on health disparities, using data to identify and act. And this is a webinar that's offered in partnership with Stratus Health. So, as I mentioned, all of these events are free, but we do require that you register in advance on the MDH Learning Management System. So, if you were registered for today's event, you will be added, if you aren't already there, to the Healthcare Homes Learn Bulletin subscriber list, and this is our online newsletter for all things related to learning. And for a recording of this webinar, you can find that on the MDH YouTube channel, and you can access that from the home page of Healthcare Homes program in the top right corner of the home page. So slides from this webinar and recordings are posted on the Healthcare Home website in the Learning Collaborative section. To receive a certificate of attendance for participating in our webinar today, please complete the evaluation that will be emailed to you following this webinar. And that is a lot of words. Wow. So thank you once again to Mark and Sarah and to Dorothy for your assistance on the technical side of things. And thank you all for attending our webinar today. Enjoy the rest of your day, and thanks again for being here. Bye-bye.